Hi, today I want to talk to you a little bit about endometriosis. So what is endometriosis? It is the name given to the condition when endometrial tissues are found outside of the uterus. Now, typically at each menstrual cycle, endometrial tissues accumulate in preparation for a potential pregnancy. But when there's no pregnancy, then these tissues normally comes off, which becomes the period that we experience. However, when the endometrial tissues are found outside of the uterus, they tend to adhere to different organs and structure within the abdominal cavity, causing inflammation and pain, and all the other symptoms that women experience. Why this happens remains unclear. But what we do know is endometriosis is estimated to be affecting between 10 to 15% of reproductive age women. It is likely that many more women suffer from it but remain undiagnosed because their symptoms are considered normal. Some women won't think of even getting medical help, or if they do, they're often misdiagnosed or dismissed by the physicians altogether. Reports indicated that diagnosis can be delayed by up to 12 years. These delays can be 3 times longer for those whose symptoms started during adolescence. Endometriosis has a significant impact on a woman's quality of life due to that chronic pain level. Women with endometriosis are more likely to suffer other health problems such as migraine, depression, and thyroid disorders. So, how do we know if we have it? The presentation of endometriosis really varies. It all depends on the location and the extent of the endometrial tissues. Typical symptoms of endometriosis is pain. It could be menstrual pain, painful during intercourse, painful during urination and defecation, non-menstrual pelvic pain, or it could be symptoms such as infertility, irregular periods, heavy periods, or they can be completely asymptomatic, where they don't know. Endometriosis is diagnosed definitively with laparoscopic surgery, although some doctors may rely on ultrasound and or MRI. So if you think you have endometriosis or you have been diagnosed, what can we do about it? According to conventional medical advice, endometriosis is a chronic disease with no known cure. Common treatments are pharmaceutical drugs and surgery to control the symptoms. Most often, women will be prescribed a hormonal contraceptive, such as a birth control pill, because endometriosis is an estrogen-dependent disease. However, some people believe there is limited evidence these hormonal contraceptives are effective as treatment for the endometriosis pain, and they can have severe side effects such as blood clots. There is also evidence showing that early use of hormonal contraceptive is correlated to higher rates of severe endometriosis later on in life. So if you start early on a birth control pill, then you might end up with much more pain later on in life. Because of pain, so painkillers are frequently prescribed. But there is few evidence on the use of NSAIDs for endometriosis pain. So what might be left is opioid or steroids. It is important to note that the symptoms typically return if one chooses to discontinue these treatments at any point. So another option is surgery. The surgery can be removing the endometriosis lesions and or hysterectomy, the removal of the uterus and cervix. There is, however, disagreement among researchers on whether surgical removal of endometrial tissues improves overall symptoms. Recurrence rates varies. It tends to happen. On average, about 20% recur at the 2-year follow-up mark. Between 7 to 41% of surgically treated patients have more than one surgery. One study found that average time between surgeries was only 1.77 years, so they can't even make it to 2 years. Hysterectomy may be seen as the last resort from some patients, but it does not necessarily remove all the symptoms either, and is unthinkable for those planning to have children. But what I wanted to talk about is there are more other options for those suffering from endometriosis. Homeopathy as an individualized natural medicine system is very well suited for endometriosis. I can tell you that from my own personal experience. With homeopathy, we consider the symptoms that individual have their own and matches the treatments to those specific symptoms that anyone feels. There are studies showing the use of homeopathy is effective for common endometriosis symptoms when compared to placebo or conventional treatment. For example, menstrual pain, pelvic pain, or infertility. Some women found symptom relief with herbs and acupuncture. Some women have used castor oil wrap around the abdomen and found that to be really helpful in relieving pain, better than the painkillers. And then there are what we call the lifestyle factors. So this could be stress management, physical activity, and diet. Because endometriosis is an estrogen-dependent disease, the impact of stress, especially chronic stress, on estrogen production makes stress management particularly important for endometriosis. As a digression, endocrine disrupting chemicals found in our daily life are also very problematic and worth looking into. Now, going back to stress, I recognize that stress seems to be an integral part of our daily life. It is so much easier talking about managing stress as opposed to actually doing anything about it. But managing stress doesn't mean we don't have stress in life. It doesn't have to be some big grand gesture. It can be as simple as remembering to take deep breaths throughout the day, or take a couple of minutes and go outside or some quiet sitting, or once in a while do something that we truly enjoy. Those are all great stress management tools. Some physical activities appear to be more beneficial to endometriosis symptoms. I've found Qigong practice to be immensely powerful. Pelvic floor physical therapy has also shown some positive results. In Chinese medicine, menstrual pain are often seen as stagnation in the pelvic area. So any activities that engages our core here in the abdomen, such as yoga or Pilates, are very helpful. Plus, physical activity generally have a positive impact to help managing stress and balance estrogen production. Lastly, diet, the food we eat. Endometriosis is an inflammatory disease, so it would be good to avoid food that are known to cause or make inflammation worse. Now, this includes all our favorite, sugar, dairy, caffeine, and gluten. Also, incorporating more anti-inflammatory food is helpful. It can be simply as easy as just adding some fat, ginger, or turmeric in your cooking, because good fats are really so important for our hormonal health. It doesn't have to be a radical change of what you eat. It could be just little changes every day. Just reducing a little bit of sugar, say in your coffee or in your tea, or replacing your milk with a non-dairy milk such as cashew or almond. Those little changes can have, over time, can have a big effect on your health. Thank you for listening.